A Republican congressman is today raising concerns about the record-keeping part of President Obama's new health care law. He says that Health and Human Services is working on a plan to have insurance companies collect your private medical records and send them to Washington. What kind of problems might that raise? Joining me now, Fox News medical A-teamer Dr. Mark Siegel, who's a professor of medicine at NYU's Langone Medical Center, Daily News columnist and co-host of The Five right here on Fox News Channel, Andrea Tintaros, and medical privacy advocate John Tuttle, who is director of Hagedorn and Company Healthcare. All right, so he is claiming, it's Congressman Tim Huelskamp, who's of Kansas. He's a Republican, and he is saying that what Kathleen Sebelius, the Health and Human Services Secretary, wants to do is demand that the insurance companies submit detailed health care information about their patients directly to Washington, or at least give it to the 50 states. And Dr. Siegel, the first thing that jumps out at me is, what about patient-doctor confidentiality? Why does Uncle Sam get to see what my doctor knows about me?
Well, absolutely right, Megan. By the way, he's right. It's in the Federal Register right here that this is exactly what HHS is planning. And I think it's going to add another layer of bureaucracy between the doctor and the patient. I think it's going to be a potential violation of patient privacy. And I'm even more concerned about this terminology that's in there: mitigate impact of potential adverse selection and stabilize premiums. You know what that means?
What does that know? What does that mean?
That means they're going to try to control premiums, control prices, look at who's sick, who isn't, try to keep everything controlled. More bureaucracy, lower premiums.
Why do they want to keep everything controlled, Andrea?
Well, that was the point of this whole law. And if you remember, they had a fight over price controls when they were trying to pass Obamacare. It didn't make it into the bill. So Dr. Siegel's right. When they passed this Obamacare bill, they made this big mistake by not making the penalty for not signing up greater than the premium. So what you have, Megan, is a bunch of sick people signing up, because they can, no preconditions, remember? But you don't have healthy people signing up. What this does is this inflates costs for everybody. So the administration's saying now, let me see those records in the exchange, and what they can do then is they can, as I read this law, they can start to kick our money, taxpayer money, in the form of subsidies to prop up insurers to keep them in the game, even when they have really shoddy exchanges.
Is that how you see it, John?
Yeah, you know, I mean, I'll tell you, one of the concerns I have is we also have what's called the Medical Information Bureau, which is already set up really in the industry to really keep track of the you know, your medical reports. So what you have here is you also have another layer of bureaucracy in the federal government that's going to hinder the quality of care.
Because I think what the folks at home, they care about the insurance and the money and all that, but I think they really care about, they don't want Kathleen Sebelius seeing their private health care information. That's between me and my doctor.
Megan, there was a Harris poll that showed that 80% of Americans are worried about having their information available online. Not even the government, online, period.
And they should be. Because, listen, this is not a partisan issue. This isn't a rip on Kathleen Sebelius. It's a rip on the government, which has failed to keep records confidential thus far. These are just a few examples that the congressman offers that we've covered here on Fox News and elsewhere. A government employee's laptop containing information about 26 million veterans stolen from the employee's home. An HHS contractor lost a laptop containing medical information about nearly 50,000 Medicare beneficiaries. USDA's computer system was compromised. Information about 26,000 employees and others was potentially accessed. And then let's not forget about politically motivated accessing, like we saw with Joe the plumber. Remember that? When he suddenly confronted President Obama on a rope line, and some Democrat in Ohio suddenly was letting his tax information out.
They only tell me what's wrong with them because they think no one else is going to hear about it. If they start thinking it's going to be publicly disclosed, people won't tell me what their problems are.
Right. Not only that, you know, you have health HHS that has already been breached 256 times in the past year.
But right now they don't have our private information.
No, not right now they don't, but that leads me to believe I'm concerned about my own personal medical information.
Right.
If they're going to have access to it, you know, once again, this is just putting a whole other layer of bureaucracy.
But let me defend the government here, because there hasn't been a lot of reporting on this, so it's still unfolding. But it seems like the government is saying we need to make sure that insurance companies are not jacking up the prices on the people with pre-existing conditions like they're not supposed to do. And how are we going to know that unless we access the medical records and know what's happening at the doctor-patient level?
I don't think that's totally fair, because the way the law is written, and you know I'm no fan of this law, they actually don't allow you to raise prices on anyone unless you're a smoker, unless
you're
older.
They're concerned that you're not going to follow that. You know, that they're going to make you take on these medications.
But I don't think
and you're going
their knowing the information isn't going to help them prevent that. How are they going to prevent insurance companies from setting certain premiums unless they put price controls?
Well, I'll tell you what they did. Sebelius came out and she said that she was going to start to have a list of insurance companies, bad insurance companies. So what she was going to do was going to be political. She was going to make statements, probably put out press releases, oh, health insurance commissioner in Pennsylvania, so-and-so, and get legislators to put pressure on these insurance commissioners to shake their fists at these insurance companies. It's very sketchy, Megyn. It's very sketchy.
Well, I don't know how else she's going to police the thing that they're worried about policing. So if they're worried about insurance companies, so you're a broker in this industry. If they're worried about insurance companies disobeying the law, jacking up prices on the pre-existing condition folks against the law, how else are they supposed to monitor that if they don't have access to this information?
You know, it's a good question, but I mean, I'm really concerned about the level of care that we're going to be getting.
Because doctors are going to try to avoid having frank discussions with their patients?
Well, overall. I mean,
And because, think about this, if they're mandating you need to cover all these people, no preconditions, but you can't raise the sticker price, right? Insurance companies are saying, fine, I won't offer everything that I used to offer.
That's exactly right.
I'll dumb everything down and you're going to get real shoddy care.
And the other thing is, by the way, Megyn, to your other point, at the statewide level, state commissioners are already looking to make sure that insurance companies don't have huge increases in premiums.
Absolutely. That's already their job.
Right. We don't need the
So you can
feds
see
doing
it
that.
collectively.
Exactly.
Let me ask you this, Dr. Siegel, because I have heard doctors say that they are not going to comply with that, with the provision of Obamacare, of the health care law that requires them to put the medical records online. That they're just not going to do it. That the government won't know. That they're going to keep it confidential because they have the same concern you have, which is my patients are going to stop being honest if they think this information is going to go online. Are you hearing any of that in the medical community?
Completely. And I also think that that's related to the whole issue of being reimbursed from the stimulus bill for going online to begin with. A lot of doctors are still sticking with paper charts. And the ones that are going to electronic medical records are trying to keep them in a certain system that isn't going to comply. I think that's going to go way past 2014.
Let me ask you this.
We have HIPAA laws to follow. We have to protect our
I know,
patients.
but and I have to say, so far it seems like the HIPAA laws, I mean, obviously with some exceptions, they seem to work. I mean, you can imagine there are people out there who would love to reveal the private information of Angelina Jolie and Brad Pitt. You know, I mean, there are people out there who would pay big bucks for that and then put it on the front page of a magazine. They haven't been able to do that, right? I presume.
Right.
But you hear reports like this, and then you start to worry.
You never know. And not only that, you know, what about somebody going in there and breaching that information and changing your information? That's another concern.
Whoa. And then the next thing you know, you're getting the wrong drug, or you're...
Absolutely.
And I don't mean to scare
That's how medical errors perpetuate.
And I don't mean to scare. I know there's a lot of seniors watching now, but the independent panel that the president put together for Medicare, they're going to have a lot of seniors' records anyway, because this panel of 12 bureaucrats is going to be deciding what care Medicare patients can get. It's already the law of the land. It should be a very big concern.
That's a great point Andrea's making now, because the information, once they glean it, is going to be used to decide one treatment better than another, what treatment should be approved, what tests should be approved.
This is what you were saying before the law even passed, that we're going to start to look more like Canada because there are bureaucrats who are going to be making decisions about cost-effective treatments.
Absolutely.
And that raises the question on the quality of care.
Well, listen, we welcome a comment from the Health and Human Services Secretary on this. If they want to clarify this report, we're all for it. Love to hear it. So far, it's this Kansas, well, Republican Congressman Tim Huelskamp of Kansas, who says you need to worry, and you need to worry about, you know, what happens if a laptop gets stolen or there's some compromise of information. Suddenly, it's real people's information that's out there forever. Online, and you know once they tell you to take it down offline, you can take it down, but it's still out there. It's
already there.
It's there. Your private medical information, I don't know. Yeah. Panel, thank you.
Thanks, Megyn.
Thank you, Megyn.
A brand new sympathy card from the folks at Hallmark, but this one is not for the